So welcome to the class tonight. I'm Dr. Lindholm, by the way. Most of you I know, but a few of you are not my patients, so I haven't met you yet, so welcome to the class. So the idea of the class tonight is we have a overriding idea here that knowledge is power. We want people to work along with us to improve their health. So the best relationship we can have with our patients is a partnership where we're working together. So part of that is knowledge, that people understand how to get the most out of their care. And in the case of many of you, we're going to talk a little bit tonight about what chiropractic is, what kind of benefits you should expect from your care here. And we're going to talk a little bit about what causes the kinds of problems that brings most people to our clinic. Okay, so you've got some handouts that I'm going to reference. The first one is kind of a little test, and it's really just so that you can play along with me as I'm going through the presentation. So these are some questions that I'd like you to try to answer as we're going through. None of them are difficult. Most of the answers I'm going to say repeatedly, so it's just to kind of engage you as we're going through. And at the end, we usually draw a little prize for playing along with me. Okay, so I always start off the slide by talking about some of the benefits of being a chiropractic patient. I truly believe that there's never been a better time to be a chiropractic patient. What's interesting, over the last 120 years that chiropractic has been around as a profession, we really, it's not that we do different things now that make it a better time to be a chiropractic patient. What's really wonderful about being a patient now in 2017 is a lot of the science has caught up with what chiropractors have seen clinically, and now we can prove why it is when we adjust the spine that people get such profound benefits with their health. Okay, so from a proof standpoint and kind of knowing what we're dealing with now is a great time to be a chiropractic patient. So what's interesting is that most people have a misconception of what chiropractic is all about. Chiropractic is really about health. A lot of people think of seeing a chiropractor for neck pain and back pain, and we'll talk in a second about that. We definitely can help with those things. But chiropractic, since its inception, has really been about health, about a lifestyle approach. And we work with the spine to improve the health and the function of the nervous system. And there's three main things that we really see that are most beneficial, that people, the kinds of results they get from chiropractic, and that's improved whole body health, better longevity, and quality of life. And you might not be familiar with those as far as that quality of life, for example, is a research term. If you were to Google quality of life benefits of chiropractic, you'd see a number of studies that have shown, and what quality of life really means is not just living longer, but enjoying life as you live, being able to what's called compress your morbidity. In other words, the ideal is to be healthy, and then right at the very end of your life to just drop off and to pass away. But unfortunately, what happens with many people is it's just the opposite. They have maybe decades of poor health. So I'd like to live to be and see my great grandchildren, but I would rather not have a long life if the last 20 years of my life is miserable. Okay, and so chiropractic has been shown to really benefit in that way. Now, as I said, though, chiropractic definitely can help with neck pain and back pain, and there's a bunch of studies that have shown that. This top one here is actually from my alma mater, from the chiropractic college that I graduated from. And they did a study that was interesting where it was published in the journal Spine, which is a very reputable peer-reviewed journal. And they found that 73% of the patients that utilize standard medical care and chiropractic care together got much better. They rated their improvement as completely gone, much better, or at least moderately better, in comparison to only 17% of patients that only used conventional medical care. So there's a great increase in their improvement in neck and back pain using chiropractic care. And this was a separate study where they looked at neck pain, seeing a chiropractor for neck pain, and that study showed a 94% satisfaction rate with patients that saw a chiropractor, which is an extremely high satisfaction rate. So chiropractic care definitely can help with aches and pains, but that's really just the tip of the iceberg of what we do. So I think it's important to kind of look at really what it is we do as chiropractors and kind of what our goals are. One of the things that sets us apart from conventional medicine is not just the treatment we do, but our whole health paradigm is different. The way we even look at health is different. Conventional medicine on the right here in black tends to be more a symptomatic-based approach, and their typical treatment has to do with drugs and surgery, and they tend to be symptomatically oriented. Whereas chiropractic is a functional approach. We're trying to restore function instead of just covering up the symptoms. And our main focus is on adjusting the spine, and I'll talk about how that affects the nervous system in a little bit here, and lifestyle changes. And the bottom here is a way to kind of put some of this into perspective or to maybe make it real for you, in that what this is supposed to represent is what I would call a health spectrum. And this gets to the difference in the chiropractic paradigm of the way we look at health, in that everybody's on a health spectrum someplace. So the ends of that are optimal health at one end, and then severe disease, or maybe you could even say death, is at the other end of the spectrum. And we're all someplace on that. And we're never static. We're always moving or changing. Conventional medicine tends to be mostly interested in disease and getting you just to not having symptoms, or what I would call the contentment zone. Whereas chiropractic, our approach is always geared toward trying to get you to optimal health and then trying to keep you there. And this has been studied widely, and we'll talk about that in a second, about the success of looking at this kind of approach toward healthcare. The best thing is to integrate the two together. So sometimes you need conventional medicine, and this has been studied. It's called Integrative Medicine. There was actually a large study where it was a 7-year study where they took patients to be in this study where they had to be seen by a chiropractor or an osteopath or a naturally oriented medical doctor as their primary care providers, and they had to be seen 14 times in a year. And what they found was that these patients had a 60% less hospitalization, a 62% less surgeries, and they had a whopping 85% reduction in their pharmaceutical use. Okay? Now, drugs are inherently dangerous. Sometimes they're absolutely necessary, but every drug has side effects, and some of them serious fatal side effects. As a matter of fact, there's some other studies I'm not going to go over tonight that show as much as 500,000 Americans die every year due to negative effects of correctly prescribed drugs. So if you can avoid using drugs, that's always better off in the long run. Plus, these things aren't just covering up symptoms, but they're actually getting at correcting the cause of the problem. So in short, this research showed that integrative medicine, using chiropractic care as a first line of approach, was very successful. All right, so I want to talk a little bit about why chiropractic can help so many things. So a lot of people, like I said, think of seeing a chiropractor for the things on the left here, headaches and joint pain, arthritis, those kinds of things. People might know that chiropractic can help things like digestive issues or sinus problems, irritability, sleeping problems. With children, we can often help with colic and ear infections and bedwetting, ADHD, ADD, those kinds of things. But the reality is that, again, this goes to that paradigm of chiropractic, is we're not treating these individual things, but really all of these things are symptoms of subluxations in the spine, or problems with the way the nervous system is functioning. You might have heard the idea or the quote that a rising tide raises all ships. It's the same kind of thing with this. Instead of treating individual diseases, what we're trying to do is improve how the body is functioning, which helps your overall function to work better. And that, again, ties back into one of those first slides where I talk about it's not just about making you feel better, but it's about increased longevity, quality of life, overall improved health. Right, so let's talk a little bit about more specifically what chiropractors do and how it can have these kinds of dramatic results. So the main problem we treat is something called a subluxation, which is an area in the spine that's out of alignment, affecting how the nerve is functioning, or the nerves, excuse me. And the nervous system controls your organs, your glands, your sensation, brain function. It controls really every aspect of your health. This diagram on the right here shows the nerves that come from the brain through the spinal cord and then out to the body, like your heart, your lungs, your immune system. And then there's just as many nerve pathways that go from the body back to the brain. And in biology, we call this homeostasis. It's a balancing act for your body to control itself. It's the way, every minute of every day your body is controlling, it's digesting your food, it's controlling your hormones, it's regulating your heart rate and your blood pressure. All of those things are regulated by the nervous system. Even what's cool is that it affects that communication back and forth to the brain, which I'll talk about in a second, which really controls how we experience life and how we interact with others. Your nervous system is the master controller of your entire body. And so when we correct subluxations and allow that communication to work better with the brain, that's why it can have such profound effects on somebody's health, make them feel more relaxed. So I mentioned I think there's never been a better time to be a chiropractic patient. This is one of the most recent studies. It was published actually in 2016, so just last year. And it was published at the study was done in New Zealand at one of the leading or cutting edge chiropractic colleges that's there. And the great thing is that this was the fourth time that they've seen this similar type of a result. And what they found was that when the spine was adjusted, they could instantly, with new technology, measure that the brain actually functioned different. Specifically, they're looking at what's called the prefrontal cortex, which is kind of the conductor of the brain, or the thinking part of the brain. Your frontal cortex is what makes us human. It's part of the brain that we have that's different from most other animals. What they found was it instantly showed a change in that brain function. So what this tells us again, or it confirms again for the fourth time, that we do an adjustment. One of the most profound things it does is it affects that communication coming back and forth to the brain, and then can affect all those things that I was just talking about. It's almost hard to wrap your mind around all the things that the nervous system controls. And so I can't go through all the studies tonight, but I do want to hit on a very important part of research that is affected by the brain and your nervous system. That's your genetic expression. And so we used to think 20 years ago that a large part of your health just had to do with luck. You know, who your parents were, and that you were predetermined by your genetics to express certain parts of health. So if your dad died of heart disease, they used to think literally you were destined maybe to have heart disease or those kinds of things. What we know now is that's not true at all. And this is, I won't go into too much detail because you can look all these things up online if you'd like. But there were two big studies. One was called the Human Genome Project, and that was a worldwide collaborative scientific study that was done by geneticists around the world, and they were mapping out the human genome. And this was elusive. It took them a long time to do this, but when they got it done, they thought that this was going to solve all of the problems with health. That if they could map out the human genes, it would tell them who was going to develop certain diseases, and we'd be able to intervene and prevent those things. And what they found was that wasn't true at all. They were very surprised that it didn't really give them the answers they thought. And around that same time, there was a different study called the Danish Twin Study, where they looked at identical twins. So by definition, identical twins are genetically identical. So if their genetic theory was correct, they should have identical health. What they found that wasn't true. They found that the high percentage of time, about 80% of the time, their health was very different. And it actually led to a whole new field of study called epigenetics, which means upon the genes. What they found is it's more how those genes are turned on and turned off that control our health. And the really great thing is what this means is that only about 20% of our health is due to our genes. That means 80% of our health is changeable. 80% of our health we have control over and we can make a difference with. And your nervous system is a big part in controlling how your body regulates this genetic expression. So 80% of your health is something you have power over. So it's a very empowering thing, and it ties into what we do as chiropractors. So the main problem we deal with in the spine is what we call subluxations. One of the problems with that is that it tends to be a hidden problem. Only about 10% of the time will you feel it, because most of those nerves I talk about work automatically. It's not that you even are aware of it. It's certainly not that those have to do with pain. So only about 10% of the nerves have to do with pain. 90% of the time, it's things that you're not aware of. So the downside is that many, many people, by the time they come in to see a chiropractor, they might have been suffering with subluxations for decades before they are aware of it, before they have pain. It's not exactly the same, but I tell people it's like if you have a toothache. You might have had a cavity there for a long time, but eventually it can lead to a toothache if you let it go long enough. So eventually subluxations can lead to pain, but it's not the best way to gauge the health of your spine. All right, so next I want to talk about what causes subluxation. So in my mind, if subluxations can cause all these problems with your health, even down to genetic expression, the next most logical question in my mind is, well, how do I prevent that? How do I prevent that from happening? So there's three causes really, or three categories of causes for subluxations. The first one I want to talk about is emotional stress. And this surprises a lot of people. A lot of people think about physical reasons for having subluxations, but emotional stress can cause subluxations every bit as profoundly as falling or lifting something heavy. All right. So the way it works is that when you're under stress, it can make you tighten up the muscles, and it can actually pull the spine out of place. And you may not be able to, I don't know if you can read the writing on this, but this is from a medical textbook called Guyton's Physiology. It's a medical textbook that all medical and chiropractic students use. And what this diagram shows is that when you're under chronic emotional stress, it feeds into the brain and comes down the spinal cord and causes the muscle to spasm in the exact same way that chronic trauma, like actual damage to the body part, feeds into the nervous system and causes those muscles to tighten up. So your body and your brain literally has trouble telling the difference between imagined trauma and real physical trauma. And so what this can happen is that over time, this can chronically cause the muscles to tighten up and, like I said, pull the spine out of alignment. All right. We have whole workshops that we do, other workshops on ways to deal with stress. So that's something that with some of my patients, I talk to them about and encourage that they go and look at some of those workshops. Many of those have been videotaped, like this workshop tonight, so you can watch them online. The next category is chemical stress, or it might be better to call it biochemical stress. And this is actually a pretty broad area of cause, and it's something that unfortunately is hard to get away from in our society. So it has to do with things like the food you eat. The standard American diet, like this shows, fast food is overly processed, low in nutrients, high in additives and chemicals. It could be drugs that you're exposed to. It could be the air you breathe. Unfortunately, where we live here, we're kind of downwind with the jet stream from Chicago and Gary and a lot of that pollution that comes this direction. It can even be things like sodas that you drink or alcohol can be toxic to the body. So this is much like the emotional stress in that it's more of a reflexive problem that happens. In other words, I mentioned that those nerves go both directions. That diagram I showed where I talked about it being what we call homeostasis, that balancing act. So let's say you're eating a standard American diet and you're getting pollution and additives and a poor nutrient diet in your body. That can irritate your stomach and then affect those nerves that go from your stomach back to your back and then cause those muscles to tighten up and pull the spine out of place. It's what's called a viscerosomatic reflex. And so this is an important aspect also of sometimes with people causing recurrent subluxations in the same area over and over again. Okay? So we also have workshops about eating healthier and about reducing biochemical stress. And then this is the one that most people think of when they think of injuring their back. And this definitely can cause subluxations, but I would say in most people, this is the least important of the three causes. So it could be something like having a fall. It could be lifting something heavy. For a lot of people nowadays, it's more what's called microtrauma. So sitting at a computer too long, or I see a lot of children, can I use your phone here? Sitting looking down at their phone like this for hours on end, kind of a thing. So, so this definitely can directly cause the spine to shift out of place, either from knocking it out of alignment or slowly encouraging that change in your posture. Okay? The normal birth process is one of the things that's listed on here, and the reason normal is in quotes is that unfortunately sometimes there's a very excessive amount of force that's used to pull the baby out, which can cause some subluxations to their neck and cause oftentimes, unfortunately, subluxations that aren't detected early on and don't get corrected for, I see adults many times where they've had a lifetime of, say, migraines or headaches or being sick that sometimes are related to trauma to their neck or subluxations that weren't corrected when they were young. All right, so you can maybe summarize that by thinking of those causes as how you think or emotional stress, how you eat, chemical stress, and how you move, physical stress. Okay. Next, I want to talk a little bit about posture, and this is kind of a subset of the physical stress. Again, there's an epidemic problem I see of people having a forward head posture. I won't go into great detail, but we know mathematically that this makes the weight of the head magnified as it comes forward. For about every inch that it translates forward, it makes the head feel 10 or 12 pounds heavier, about twice as heavy as it comes forward. And this is kind of common sense. Some of you, I might have had you use that little black ball as a demonstration when you came in. That's a 10-pound ball I have people hold. If you had to lift a weight, if you lifted it in close, or if you were, say you were holding a baby and you're holding it close, it'd be much easier than if for some reason they had a dirty diaper and you had to carry them out away from you like that, okay? So with the head though, it's all day long, every day, that stress is affecting your neck and affecting the nerves that come through there. So good posture, whether you're standing, sitting, sleeping, is that your spine should be straight from the front, and then your head and your shoulders and your hips should be in line from the side. You're designed from the side, this actually picture isn't the best, but you're supposed to have a forward arc in your lower back and a forward arc in your neck. Those arcs or that posture increases the strength of the spine and makes it actually 9 times stronger by having those arcs in the spine. Okay, and this is another picture that shows the same kind of thing. Your spine should be, like I said, straight from the front to the back, which means your hips and your shoulders should be in line from the back. This shows just some problems with posture where maybe you might have your head forward or have a sway back. Although you want those arcs or curves in your spine from the side, your head, your shoulders, and hips should be in line from the side. Okay, and then you all have this handout in your materials. This is just designed for you as a take-home. If you have other family members at home that you want to check their posture, posture can be a good window into the health of the spine. So if somebody's head or shoulders are tilted, their head is tilted, that's usually a pretty good indication that they've got some subluxations or problems in their spine. So this just walks you through how to check somebody's posture if you'd like to do that at home. So again, the posture is a good window into the health of the spine. All right, so next I want to talk a little bit about the care that many of my patients go through and kind of the stages of recovery that we see with many of our patients. And it ties into the way, again, a paradigm of the way we look at health. So many patients come in to see us and they do have some kind of a problem. It might be a problem with their digestion, it might be problems with headaches or back pain or those kinds of things. And so often we're in a corrective care type of a focus at first, where we're seeing them often. We're trying to get the pressure off the nerves, get those joints healthy and moving again. And we're often seeing them pretty frequently during this initial stage, okay? But our goal is not just to get them to that contentment zone. During this stage in the middle of their care is usually when we're starting to see them a little less often, but we're still adjusting them. And often at this point is when we're talking to them about at-home exercises they need to do to strengthen their spine. Or it might be a time when we're talking to them about, now that we're starting to make some changes in your spine, I think maybe you might be affected by chemical stress in your life because you work spray painting RVs all day. I think you're probably, we need to do some things to try to decrease how that exposure to your body. Or it might be another person that person is suffering with a lot of emotional stress. And so we might be counseling them about trying to reduce those aspects of causing subluxations. And then the last phase is probably the most important as far as long-term really benefiting from improved health, and that's what we call wellness care. Like I said, the whole idea of chiropractic is to get you to that optimal health and then spend most of our energy trying to keep you healthy as opposed to constantly just fighting symptoms and disease. So during this phase, we're usually seeing you infrequently. It might be seeing you every 3 or 4 weeks. We're checking you to try to be proactive and preventative. That study I mentioned that showed a 60% less hospitalization, a 62%, 62% less surgeries and 85% less pharmaceutical use. Those patients were wellness care patients. Like I said, to be a member of that study, they had to be seen about once every 3 weeks. So that's where we really get some of the profound benefits and longevity and quality of life. All right, so how many of you have ever set goals maybe for like work or for school? Anybody do any goal setting? Okay, a couple of you that'll admit it anyway. So goal setting is a really, it's an effective tool to make changes or to make results. And so I want to talk about it tonight a little bit in context of making changes with your health. So people sometimes don't think about doing it with their health, but I think this is a really good strategy. And there's a lot of different goals. This is going to be personalized for each person. So maybe your goal is to use less medication, or again, to decrease your stress, to have more energy, to take fewer drugs, those kind of things. So this goes back to that epigenetics study I was talking about, that these are the kinds of things that we have power over. About 80% of our health, again, we have control over, and it's stuff that for many people doesn't really cost any money. It just takes some effort, okay? So it can be huge, the kinds of things that we can teach ourselves to do better to really take control of our health. So you have a handout like this in some of your packets. And so this is just designed for you to help you to kind of work through setting some health goals. So a couple things I would mention is I'd recommend you only pick 1 or maybe 2 health goals, because usually if people try to tackle more than that at once, it's just not successful. So I would, and if you have trouble with this, if you're not sure what would be best for you, that's part of what myself and Dr. Martins and Dr. Hartman are here for. We can walk you through this. So, but I just want to explain an idea. So let's say that right now you're not exercising at all, and your goal is that you want to start exercising. So your health goal would be, let's say for example, somebody that's not exercising at all, that my goal is to walk a mile 5 days a week, and my target date is I want to be doing that regularly within a month, okay? So, and the target date is important because I tell people that a goal without a target date is just a dream. Okay, you have to have something to hold you accountable. All right, so, and then you're just going to list out things that are going to help you with that and things that might hinder it. And then you're going to write out an action step. So the example of starting to exercise is maybe, first of all, you need to get a pair of good walking shoes. Maybe you need to map out a safe place to walk where you're not going to get hit by a car, you're not going to twist your ankle. Maybe with a lot of goals, not just with walking, maybe it'd be helpful to have some social support. So maybe you want to enlist a friend or your spouse or somebody to walk with you, be your walking partner, because you're going to be more likely to do it if you have somebody that you tell, okay, well, 5 days a week we're going to meet at 7 o'clock after we drop the kids off at school and we're going to walk for a mile, that kind of a thing. So some things that might hinder that is that it's not always beautiful weather in Elkhart like it is today. So maybe you need to think about, well, what am I going to do when it's raining? What's an alternative exercise I could do? Or can we go to the mall and walk, or just go and walk around Walmart or something? What am I going to do in the middle of the winter when there's 2 feet of snow? Those kinds of things. Or what am I going to do just when I wake up and I didn't get enough sleep and I'm not feeling well? Can I maybe walk at a different time in the afternoon? Those kinds of things. Okay? So I only use walking or exercise as an example. This could be a number of different things. Okay? All right. So kind of in closing, I want to talk a little bit about actions that you should take. I think it's important for people to learn how to eat well, move well, and think well. And we all come into the clinic here sometimes at different levels. So some of you might already be, for example, experts on good nutrition, or another person might be an expert on exercising effectively. But the idea is to fill in your weak areas, so to speak, and we can be, again, a resource for a lot of those things. I think it's important, if you do have to access conventional medicine, that you ask specifically what's causing my problem. Ask if there's any alternative treatments that you can try, and what your treatment options are. For example, like with back pain, for somebody that has severe back pain or like a disc herniation, I really think it should be malpractice if a doctor is recommending surgery and they haven't tried a course of chiropractic care first. Those kinds of things. So it's always best to, in that regard, to try to do invasive procedures as a last resort. So trying to do things that are safe and natural first, and only progress to the more dangerous things if you have to. And I think it's really important for patients to be part of the decision-making process, to not feel like they have to just accept everything their doctor tells them to do without discussing it with them. Okay. All right, so part of our mission here at the clinic is health promotion and really getting this kind of information out that I've explained to you to others. So I would just encourage you to tell others about your experience here. Chiropractic care, in our clinic and just in general is very effective. So the vast majority of our patients have wonderful results. So I just encourage you to share that with others. Many of you were sent here by somebody else that referred you, and I would encourage you to let others people know about your results. On a larger group setting, we do classes or workshops. All 3 doctors are members of an organization called the Foundation for Wellness Education. And it's a nonprofit group that we're part of, where we go and do talks at service groups or at lunch and learn kind of presentations or health fairs, those kinds of things. Not necessarily this topic, but we might go and talk about stress reduction or proper nutrition or exercise or all different kinds of things like that. So if you're a member of one of those groups, we try, if at all possible, to make time in our schedule to do those. So just you can let any of my assistants know, and we can try to see if we can work that into our schedule. And then on a more personal level, we have a program called Care to Share. And I don't know if any of you took advantage of this when you were referred into the office, but basically what it is a little certificate that you can hand to a person. So say you have a friend or a neighbor that really needs to see a chiropractor, but they're not quite sure if they want to take that step. This is a certificate that has a coupon in it for a reduced cost on their initial exam, and it has some information about the clinic. It has one of our brochures in there. Okay. All right, so let's see how we did. Most of these I said a number of times. So chiropractic, improving the health of the spine and the nervous system results in 3 things: improved whole body health, longevity, and quality of life. Everybody get that one? Okay. This one I know I said a bunch of times. Chiropractic care and integrative medicine resulted in an 85% reduction in pharmaceutical costs. What percent of our health is not determined by our genes? 80%. That's 80% that we have control over. And then I didn't mention this one too many times, but posture is a window into the health of the spine. So your posture is important. And the last one really isn't a question, but just one of your homework assignments for tonight is to fill out one of the health goals. So I want to thank you all for coming to the class tonight and for being engaged. I'm going to be here for a few minutes afterwards, so I'd be happy to answer any questions if you have specific questions. All right, thank you.